Every year, I travel with a group of American medical providers to these underserved villages. Most of these towns severely lack basic resources like sanitary living, clean eating conditions, safe drinking water, and access to basic medical care. The people living on the border here of the two countries, the Dominican Republic and Haiti, have been rendered stateless since neither country claims them and neither country will offer them health care. They came here generations ago with the promise of Dominican citizenship if they worked for meager wages in the sugarcane fields. The promise was broken. The Dominican Republic won't grant them citizenship, and so they don't qualify for jobs or travel, university, medical assistance, or food assistance. The medical group I travel with is called International Medical Alliance of Tennessee. They bring medical students and nursing students to the Dominican Republic 8 to 10 times a year. And in February, when I go, it's the largest group. I act as an interpreter, helping patients communicate with the doctors and nurses, and vice versa. Actually, I have the best job. I also explain how to take meds dispensed in our pharmacy, and I get to go on house calls with one of the doctors when they go. The first week I'm there, we do general medicine, women's health, including pap smears, pediatrics, and sometimes even dental. Each day, like a MASH unit, we're in a different village, sometimes going into the mountains on flatbed trucks, which is quite an experience, actually. Other days, we travel by bus to other villages. We spend the day seeing everybody in the village who wants to be seen or needs to be seen, and we keep records of every person we see. The following week, I stay on while the medical team returns to the States. A new team comes in, eye specialists and GYN surgeons come in, and we focus our treatment on doing eye surgeries and checkups like cataracts and eye exams, and GYN procedures like LEEP procedures to remove abnormal cancerous cells in the cervix. Sometimes we do things that change lives, like helping someone see after they've spent years not seeing due to the cataracts they have. Other times we do things that save lives. For example, we remove cancerous cells that were discovered from pap smears that we had done in our previous visits. We also offer the chronically ill patients who suffer with diabetes or high blood pressure a year's worth of medication. Over the course of the many, many years that I've gone down there, I've seen dramatic change in the health of the different communities we serve. We've stopped going to some villages because people are eating more healthy. They're exercising, they're walking in the evenings, they take their prescribed medications as instructed because they trust us. And it's really quite exciting. The final piece I want to say is that we are a mom and pop organization. We have no paid staffers, no one. Absolutely no one gets paid. We're all volunteers, including the director and her husband. We all pay our own travel. We all pay for the food and the medications we bring down. So all the money that you donate here goes to direct patient care. We are a small organization, but we do mighty things. Thanks for joining us tonight, and thank you so much for your generous donations.